Thank you so much for staying on the AM show. It's now time to talk health. And 5 cases of monkeypox have been confirmed in the Eastern Bono and Greater Accra regions. That's according to the Ghana Health Service. Now, one of the cases was recorded in a Ghanaian who traveled to the United States of America. To help us have this conversation on understanding what monkeypox is all about, we have Dr. Fred Adomako-Boateng. He is Director of Health for Bono East, Charles Nora, an epidemiologist, and with the Ghana Field Epidemiology and Laboratory Training Program, University of Ghana. Thank you, gentlemen, for your time. Hello?
Thank you very much.
Thank you. Good morning.
Good morning. Great to have you here. Now, I remember, Doc, and we spoke a while ago about the situation with regards to COVID in the Bono East region. And I remember that we said we were not out of the woods yet when it comes to COVID-19. But here we are facing another situation, that's monkeypox. And we will be going into the details of what it is, how we can prevent it, and what signs to look out for. But let me start by finding out from you how you have recorded a monkeypox situation, right?
No.
Not in the Bono East.
Yes.
Okay.
And we are hoping we won't.
But tell us really what is happening. I'm sure a lot of people are feeling what's happening in our world. We dealt with COVID-19. Some people are still battling with the disease. And when we thought we could just get a breath of fresh air, here we have monkeypox. What's happening in our world, really?
There are a number of issues. And I don't want to be a prophet of doom. We should expect more if we don't change the way we do things globally. Because the epidemics are going to come and go, but the frequency depends on the way that we live as a society. For instance, if the other issues, we are invading on the habitation of animals, wild animals, then they will have to come and live with us. That's one of them. Their diseases then become ours also. So that's also another. Then if you also look at in terms of globalization, the way people are migrating to the urban communities. And so there's kind of traffic and overcrowded areas as compared to what we used to have. And so that initially, if it was taking a longer time for a disease to be transmitted from one community to another, now that access is more reduced because of the way that we travel together. So that's the other thing. So we are not going to come out of the epidemics now. What we have to do is that how do we plan and mitigate them as to when they come? That should be the discussion. How do we make sure that when they come, we're able to get them early, isolate the cases, and then prevent other people from getting? What measures do we put in place that when people even get it, we are able to take very good care of them? That should be the discussion. For me, it's not a matter of when, but it's a matter of how prepared are we to fight when we have them. And as you said, COVID is still not out. As we are speaking now, Bono East, we have about 3 active cases. It's been quiet for a long time, but you can see that it's still not gone. But so what do we do as a country, as a region, to make sure that we're able to pick it as early as possible and then we prevent loss of life and property? That should be the discussion for me, looking at how the world is going.
Let me find out from you, Mr. Charles Nora, on your part, what do you think is accounting for what we are seeing happening across the world when it comes to infections and viruses?
Yeah, so good morning once again, and good morning to your viewers and listeners. So I think I agree more with Dr. Adomako's submissions, largely because the WHO had earlier predicted that once cases were, we started recording cases in some countries crossing into regions, the cases were going to go up into countries where hitherto were not endemic areas. And so the question is, how should we be preparing towards responding to outbreaks like this? So I think to a large extent, this has been predicted, and we need to really prepare for a response, other than the question of when are we going to have the next epidemic. And largely because the ecosystem has been disturbed. And once the ecosystem is disturbed, over 70% of most diseases that affect human beings comes from animal origin. So that is where we refer to as the zoonotic diseases. They form over 70% of all the diseases that currently causes pandemics globally. And so if we don't look around and fix the issues of the ecosystem, and we continue to disturb the natural habitat of these animals, the diseases that live with them will eventually cross to human. And the most worrying part is that if they are able to cross to human and there is that ability of person-to-person transmission, then we have a situation on our hands. So I think the question should really be, how prepared should we be as a nation and as a continent to respond to this?
I'll have you two hold on. We've been joined by Dr. Franklin Nsidu-Bekwui. He is Director of Public Health at the Ghana Health Service. Good morning to you, Doc, and thank you for joining the program. So we have another, if I may say, kid on the block, that's monkeypox. And a lot of people are beginning to share an opinion about this. There's a lot of talk about monkeypox. Let me find out from you first and foremost. There are those who trade in bushmeat, and since we had the likes of Ebola, they've complained about how, you know, these diseases have affected the purchase of their goods because we're always associating it with bushmeat, like we just heard the epidemiologists say. With monkeypox, are we affected if we consume bushmeat?
Okay, and thank you very much. So I think that when it comes to managing pandemics, the cost issue should be put on the back burner. Okay. The issue is about public health. So you cannot say because of your losses in product, people should consume what they shouldn't consume. This is by the way. But what I'm saying is that it depends on the disease in question and the way it's transmitted. So you need to look at the habitat of the viruses. So for monkeypox, they are talking about the natural reservoirs being monkeys or rats or squirrels. So what is crucial is the way these animals are handled. So it's not just the eating. It's because if, let's say, you want to kill a squirrel, I think you need to catch it and dismember it. So by so doing, you get into contact with the secretions and blood. So in that case, you are talking about contact with your skin. So that's how come the caution is. So it's about avoiding contact. So we need to be able to be sure where are the natural habitats of these pathogens. So we tend to have limited information about what's the scope of all these viruses. So for now, you're talking about squirrels, talking about monkeys, talking about rats. And I think that for now, we are not saying full banning the eating of these things. We are talking about the handling of them. So I think that's the general information. But as has been said, we are getting more zoonotic conditions because man is eroding into the habitat of animals. So we are actually encouraging the contact between ourselves and then the animals. And when you do that, you inherit the disease of the animals. I want to say that this talk about monkeypox is trying to override our focus on COVID-19. And I think that's an issue that is of concern to us. Monkeypox is fatal, but there is level of disruption is not compared to COVID-19. So I think that things must be put in that perspective. As far as we are concerned, monkeypox is not very new, though it's new to Ghana. Nigeria and Central Africa, including Cameroon, have had monkeypox over the years, and it has been managed. So far as our health staff, our workforce, are not overloaded by COVID-19, we have a system in place to handle any threat of monkeypox. And I think that we want that message to go clear so that we don't use all our energies to fight monkeypox.
One
thing that I think, which is I would say is an advantage or opportunity for monkeypox is that the transmission is when the person is infected. Unlike COVID-19, that you can have transmission in an asymptomatic person, which is very tricky. So I think that there's a way by which you can actually curtail the effect of monkeypox.
Okay, because once you brought in the issue of COVID, I was going to ask if it is as contagious, if monkeypox is as contagious as COVID-19, but you've answered that question. It would have to take someone to show symptoms to transmit the disease, right? Yes,
and so if you look at the productive number of monkeypox, I think it's about 1.1, whereby you can talk about Omicron that goes in excess of 5. So the transmissibility of monkeypox is less compared to COVID-19, and I think that's one thing that we want to push across. And luckily, I think that if you look at the case fatality over the world, it's very minimal. So what I want to push is COVID should not overstretch our health workforce, so that if we get some cases of monkeypox, we cannot handle them. And I think that is the way we want to manage them. We have a good civil system that can actually dictate the cases, contact trace, so you can contain them. But then if they are overrun by COVID, then in that case, their work is minimal. And then that's the time that we may have our health will be overrun by monkeypox.
All right, Doc, I'm told you have to leave, but just one final thing. I'm looking at an article by Nature, and it's saying that countries such as Canada, the United Kingdom, and the United States have begun implementing ring vaccination to try to halt the spread of monkeypox. Is that something we're looking at, or we just want to use the protocols to try and deal with the situation?
No, I think that vaccination, everybody will say, is really the ultimate form of control. But we can actually handle monkeypox for it to get to that level. So I think that I want our system to be very effective in terms of our surveillance, about early detection, so that we don't get that those kind of large numbers. I'm not sure about the level of vaccines around. You know this issue, the challenge we have about this COVID. We do not have any vaccines. So I think it's early days yet. Let's focus on our surveillance, detect the case early, and manage them. So it becomes a very little kind of outbreak that can actually overcome. When the vaccines come, we use them.
Thank you very much for your time. Dr. Franklin Esiedu-Beku is Director of Public Health at the Ghana Health Service, and we just had to let him go. But we still have our two guests to continue this conversation on monkeypox and how we can identify it, how we can all stay safe. We've got Dr. Fred Adomako-Boateng, who is Director of Health, I beg your pardon, for the Bono East region, and Charles Nora, who is an epidemiologist. So let me come to you, Dr. Adomako-Boateng. Let's come to the specifics. How do I stay safe? How do I protect myself from contracting monkeypox? I'm sorry, Doctor.
Cardinal way of transmission is by contact. If you remember what Dr. Esiedu-Beku said, that the rate of transmission is not as compared to COVID-19. One of the critical ways that one can get the disease is when you are in close proximity with an infected person, and you can get it through the body fluid of that person. So if you look at the current outbreak, it's really clustered among people who are really having some intimacy together. So that's one way of getting it. Body fluids through contact of a person. The second way that you can also get monkeypox is when we have large respiratory droplets as compared to COVID. So you see the droplets in monkeypox are quite heavier as compared to COVID-19. And then you have to also to be closer to the person for a longer period before the person can transmit it to you. So you can see the dynamics of how monkeypox is transmitted to the other person. So in this context, that's what we will have to look at. Contact, that is skin-to-skin contact with a person, face-to-face, and that one is through droplets, heavy droplets, then mouth to skin. These are main modes of getting it. So we shouldn't be worried, as Dr. Esiedu-Bequin said, but socially, I mean, when you have these lesions, you can't go into other social gatherings. And then also the way that we are transported, we move from one area to the other. You see that we are actually able to other persons. So these are ways that we can transmit the virus from one person to that. Then to touch on, is actually not consuming the animal that is infected that you get the monkeypox, which we call the oral tube from the mouth. No, this one is actually when you get in contact with the skin of the infected animal. So we should look at that. It's not really consumption, but when you get in contact with the infected monkey, squirrel, rodent, any other animal that's infected, then you get it. But we should know that that is not a way to sustain transmission. Most of the time, when there is an outbreak, an index person, one person gets it. What actually will sustain the transmission is from person to person, person to person. And you know the conditions that will let this be right, especially in crowded areas, as we have been discussing. Then also the other with the respiratory routes, especially when we know how it's gotten. So there are two distinct animals that we are discussing.
All right.
In terms of case fatality rate, as Dr. Esiedu-Bequin said, is not really, really high. And even if you look at the people that also tend to get it also, these are all other factors that we will have to look at when we are looking at monkeypox in context.
All right, Doc. You mentioned how the virus is transmitted from animals to humans. What about humans to human, especially with emphasis on the skin to skin? Are you saying then that if I come into contact with the sweat or the blood of somebody who's been infected by monkeypox and it touches my skin, I'm going to get the virus, or like COVID, it needs an entry point, like my nose or my eyes? Just help us, please.
So you get it through the fluid. So especially if you have lesions on that particular person and the lesion happens to get on you, there should be a breach. So if there is a cut anywhere on the skin, because it cannot actually go through. So if there is a cut, then that virus will get entry through the blood system and get into. So that is one way of getting it, because if you even look at the presentation and how it's going to present when we discuss it, so there should be a breach where the fluid of the infected person should get in contact with that. And normally when we are saying that, you actually need a micro breach in that skin so that the viruses that you cannot really see will penetrate into that. So in terms of contact, that is how you will get it. You will have to actually get in contact with the lesions, the fluid, the body fluids. Even as we said, if the body fluid is containing it and it comes in contact with a breached skin, your skin is exposed somehow, then you get it. Then also when it's through respiratory droplets, as we have discussed, through the mucous membrane, for the eye, for the nose, for the then that means you are able to get it. So that's one of the major ways of getting the true contacts.
Mr. Charles Nora, let me bring you in because of your specialty as an epidemiologist. Your job includes determining how to control or stop the spread of viruses or prevent such infections from ever happening again. Now, the first time monkeypox was identified, it was in the Democratic Republic of Congo in 1970 in a 9-month-old boy. So since 1970 till now, the question is, why have we not been able to stop this particular virus? Like it's happened for other cases, like the smallpox. What is the nature of the virus, and is it that we have to brace ourselves to live with them, you know, and not eliminate them totally?
Okay, so I think that we must get the trajectory of how these viruses affect human populations. And we are saying that it's coming from an animal population, so first of all. So the world first discovered monkeypox virus in 1970, as you rightly mentioned, and since then there have been very few cases in just 1 or 2 countries, namely Cameroon and Nigeria. And once they continue to exist in those 2 countries, it poses a threat to the entire world. And so those countries had become endemic for monkeypox. So periodically, you would have people getting in touch with animals that have the infection, or then they propagate it from human to human transmission, like Dr. Adumako has also explained. So since the pandemic in 1990, we have had the situation endemic in about 2 countries. And once they continue to exist, they become a source of transmission to any other countries. Remember, almost all the countries that have reported cases, the first cases that were reported, for instance, in the US, were from travelers. And in our case, we also have a traveler for the 5 cases that have come in. So the diseases don't move. It is human beings that will move. And once we have them in parts of our population around the globe, and the world has become a global village, we will continue to have these cases spread until we work together. And that's the reason why the Spirit of One Health, working with the veterinarians, and they work with the animals, and they are specialized in controlling infections in the animal population and wild animals. So the human health and the animal health have to work together so that we can begin to reduce and then eliminate gradually these diseases that affect both animal and human populations.
Dr. Adumako, let me come to you. So we've spoken about how this is transmitted, but how do I know if I have been infected by the virus? Let's do this quickly in about 2 minutes so that people who are at home can look out for certain signs and report to the nearest health facility once they experience the signs or show the symptoms.
So the first one is almighty fever. You have an unusually high body temperature. That is one of them. Then the second one that I will want to talk about is, and permit me so that I can do further explanation.
Okay.
What we call swollen lymph nodes. And I will do some explanation. You know, we have some structures in our armpits and in our groins.
Okay.
That normally helps us to fight against diseases. With monkeypox, when you have, you see some bumps in your armpits. They are hard. And that's what we call that your lymph nodes are swollen. It's very important as compared to COVID. You remember we didn't talk about anything like lymph nodes. So it can be in the two armpits or in the two groins. When we feel these, they are lumpy, they are rubbery, but they are unusual. They are unusual. And it's important that when you have those presentations. Then the other one is headaches that you cannot actually pinpoint to any particular reason. Then your muscles backache. So these are some of the, I would say, non-specific signs of monkeypox. They are non-specific in the sense that most diseases present like this. Then the other one, almighty one, that will come up with the lesions, which normally will start around your face or your chest or at the back. Then it will spread outside to your arms. These are the things that you will see when you think that you have monkeypox. But I will have to emphasize, there are a lot of presentations that look like this. And therefore, you don't jump into conclusion by the mere fact of having these signs and symptoms. You have to go so that we take sample and that we'll be able to confirm. You remember the initial one that we had at Shama, Western region, that almost everywhere they said that we had monkeypox in Ghana for all of us to test and see, because there are a lot of presentations that mimic this kind. For example, fever, headaches, and all these body aches. These are the things that you see. And the other thing that you also will have to look for, if you have come in contact with somebody who had these lesions, you also should be thinking about, it's likely that because I have been in close contacts with this person, or I have been in some environment where there's a likely of the rashes, then these are things that will prompt us.
All right, Doc. So these ones that you've mentioned, they come before the skin eruption, like what we are seeing in the image behind me, right?
Yes. You will have to. They will always precede these before. And even as we said, you see this presentation is at the arm, the arm and the lower part of your arm. But normally, it would have started somewhere, typically, before it was spread to these. And we know ourselves better than any other person. That is what I would say. That since you know yourself and some of the presentations that will come to you that you see are atypical, not normal, then it calls for you to go for examination.
Finally, Doc, so apart from reporting to the hospital early enough when you see these signs, we are being told that one way to also prevent this is to stick to what we were doing during the height of the COVID-19 pandemic. That is to wash our hands and keep sanitizing and keep our personal hygiene. That's right.
That's right. And I think this is where we should go now as a country, because the epidemics are upon us, if I can borrow this word. And therefore, we will have to make sure that some of the things that we do to prevent them are part of our normal lifestyle. You remember during the peak of COVID, almost everywhere that you went, you saw a Veronica bucket, soap. Everywhere we went, they were giving you sanitizers to sanitize our hands. And when we are not feeling well, we stayed in the house or we had cold. We put on our mask. These are the new normal that we said we should adhere to, with or without monkey or COVID, so that when they become part and parcel of us, then some of the diseases unknown to us, we will abort them and prevent them. How do we make sure this is our lifestyle going forward?
I really appreciate your time here this morning. Dr. Fred Adomako-Boateng is the Bono East Director of Health. We also had Charles Nora, who is an epidemiologist. And then we heard from Dr. Franklin Esiedu-Bekwe, Director of Public Health, Ghana Health Service, on this particular issue. So remember to stay safe, keep washing your hands, and practice all the safety protocols.